There are many things that we do in our everyday lives, but there are only a few things that we do without thinking. One thing that we do every day without thinking is to walk. Because we walk without thinking, the way that we walk is ideal for identifying problems or issues that we may experience during our lives. The problem that we face is that it is very difficult to watch a person walking and for our eye to process everything that is happening. A stride of walk takes approximately 1100 milliseconds, and each foot is in contact with the floor for at least 440 milliseconds of the stride. Hips are moving, thighs and calves are flexing and extending, and knees are bending. The limbs are not only moving forwards and backwards, but there is also side to side movement. Our eyes typically perceive images if they are spaced by 90 to 100 milliseconds, so with multiple events occurring simultaneously, the human eye is unable to process everything that is going on. The way that we walk, or our gait, can show exactly how an injury or a condition is affecting us. Therefore, our gait can be used to help decide how an injury or condition might be treated, or perhaps whether surgery might be required, or even an alternative treatment process that could be utilised. If our gait shows signs of improvement, then it is an indicator that we are recovering from our injury or condition. So, how can we understand the detail of the way that somebody is walking well enough to enable us to make these important decisions? The development of a system to objectively analyse the way that we walk has become more and more important. What was needed was a system that was quick, easy to use, and yet as accurate as the optical gait labs that are used in our hospitals. There is only one system that can meet all of these requirements, and that system is GaitSmart. GaitSmart is a gait analysis system that uses 6 small sensors to measure the exact movement of a person in a real-life situation. The sensors are placed in self-retaining straps that can be applied over clothing, and when in place, the person can walk anywhere on any surface and the data is collected. As a simple exercise, let us take a look at a person walking and see what you can tell from the video. Afterwards, we will look at the GaitSmart report to understand exactly how the person was walking. We've seen the patient walking from the side. That means we're looking at what is known as the sagittal plane. And now we're going to look at the patient from the front and the back, so we can see what is known as the coronal plane, side to side movement. As you could see, even with the walk shown in slow motion, it is still difficult to identify any issues, and it is impossible to be able to quantify those issues. GaitSmart is able to analyse the movement in detail and to provide the results in an easy to follow report. The report that you see here is the detail of a stride from the walk that you just saw the patient take. The system picks the most typical stride, that is to say the stride most representative of the other strides taken. It is not an average stride, but an actual stride. The graphs on the left show the movement of the individual limb segments. The left limbs depicted in blue and the right limbs depicted in green have been overlaid so that you have an immediate visual identification of any asymmetry. The graphs are named so that you can easily identify the various elements, for example, hips, knees, pelvis, thighs, and so on. The figures in the boxes on the right are the actual measurements recorded during this particular stride. A traffic light colour coding system is used to show any movement that falls outside of healthy parameters. If we focus on the knee element in the graphs on the left, you will see that there are 2 different line profiles. The first high sweep is the knee during the swing phase, or when the foot is off the floor, and the second profile is the knee in the stance phase, or when the foot is in contact with the floor. All of the graph segments are time aligned so that you are able to see exactly what that segment is doing at any time during the stride. You will also notice that the lines are different colours. The left leg is depicted in blue and the right leg in green. The result is that you can immediately see any differences in movement between the left and right hand sides. As I mentioned previously, you are able to see what the various elements are doing at any point during the stride. For example, you can see the beginning of the stance phase as shown by the knee, and if you look further down, you are able to see what the pelvis, thighs and calves are doing at that point in time from a medial lateral perspective. Here we have used a silhouette man to show exactly what is happening throughout the stride. The silhouette man has been placed in the knee segment as that is easier for most people to relate to. The first half of the stride in our report is known as the swing phase. As you can see, the thigh travels forward and the calf lifts upwards and a point is reached where the maximum knee angle is achieved. The thigh then continues forward and the calf straightens in anticipation of the foot contacting the floor. The knee angle, therefore, has to decrease accordingly. The foot contacts the floor and this begins the stance phase. As you can see, the angle increases again during the stance phase, and this is referred to as flexion on stance or stance flexion. This is effectively a shock absorber for the legs, reducing impact through the limb. The knee angle will decrease as the person moves through the stance phase as the leg is straightening, ready to begin the next swing phase. Let us take a look at the various elements of the report before we look in more detail at the specifics of this particular individual. Now let us focus on the specific elements within the stride. The top element shows the hips. If the hip range of motion is reduced, less than 30 degrees, or there is an asymmetry between the left and the right in excess of 13%, then this could indicate that there is a problem. Hip asymmetry could indicate a problem with the joint itself, or it could be because the patient has had a hip replacement or resurfacing and is currently in the recovery phase. Reduced hip range of motion could indicate a muscle strength issue or a poor walking technique. The next element shows the knee movement. Once again, we are looking at symmetry and range. If there is a noticeable asymmetry between the knees in the swing phase, then it could indicate an ACL issue or late-stage knee osteoarthritis amongst the more common issues. It could also be because the person has undergone invasive knee treatment and is recovering. Stroke victims can also have poor range of motion on the affected side. If the knee range in swing is low, then it could be a muscle strength issue either through injury or even muscle attrition in older people. This can also be an indicator of late-stage knee osteoarthritis as well. If the stance phase is showing an asymmetry because of a reduction in range on one leg, then it would indicate a reluctance to bend the knee under load. This is often an indicator of early stage knee osteoarthritis, but could also be caused by other conditions within the knee joint. The next element is the pelvis. There should be minimal movement in the pelvis, so if there is a pelvis movement that is greater than 12 degrees, it is indicating an issue. This could be a compensation movement, where the excessive pelvis movement is compensating for a hip problem, or even an upper body issue that affects balance when walking. An asymmetry in the thigh segment would tend to match with a hip asymmetry, and therefore the conditions described for the hip previously would apply. A range of motion deficit in the thigh range could be muscle strength or poor walking technique. The thigh range should also be reviewed with the thigh medial lateral movement to fully understand the walking pattern. Poor gait patterns do need to be rectified, as they can put an incorrect loading on joints, muscles and ligaments that can result in longer term issues. In the calf segment, whether it is a range issue or an asymmetry issue, it tends to point towards a foot or an ankle problem. The profile of the calf in the stance phase can identify whether it is the foot or the ankle that is causing the problem. If there is excessive pelvis medial lateral movement, it is indicative of upper body movement. This may be as a result of lower body out of plane movement, poor core muscle strength, or even back or hip pain. Excessive thigh medial lateral movement can have a number of causes. Amongst them are large thighs that cannot move forward in a straight line, a quad muscle strength imbalance, or even a hip joint issue. Excessive calf medial lateral movement could indicate poor calf muscle strength or a foot loading issue. All of the segments that we have just reviewed have their supporting data with detailed measurements displayed in the data boxes on the right hand side of the report. If we now focus on this particular report, we can immediately see that there are a number of amber highlights. In the range of motion box, we can see that both hip ranges are highlighted as there is reduced movement in the hips. The right knee has restricted range, having almost 9 degrees less movement than the left. You will notice that the knee ranges are both highlighted in green, which indicates that both knees are within healthy parameters, but you will also notice in the bottom box, titled Symmetry Score, the knee is highlighted with an asymmetry of 13%, which is a bit of a concern. Going back to the range of motion box, you will also notice that the thigh range has an amber border. This indicates that the thigh range is low but is still within the green healthy parameters. However, it is very close to being an amber. In the quality of gait score box, you can see that stance flexion on the right is low and is highlighted as an amber. It does have a green border, so therefore it is close to the healthy green parameter, but a concern nonetheless. In the symmetry score box, you can see that the stance asymmetry is almost 46%. In summary, this person has low knee and thigh range on the right hand side and also low stance flexion on the right. This is the pattern that we would expect to see for somebody still recovering from an ACL reconstruction. We can also see that the patient is experiencing pain on load on the right knee during the stance phase. This would indicate that a further complication may be occurring. This patient has undergone an ACL reconstruction on the right knee. However, as we can see, he did not return to normal movement following the surgery and has now been referred to a specialist for further treatment. Even though we watched the patient walking in slow motion and not normal speed, we were still unable to see the problems they were experiencing, and we certainly could not quantify the levels of the problems to be able to make a successful diagnosis and treatment. We have scientific evidence that shows there is no reason why we should not continue to walk well into old age. However, we need a more objective approach to analysing the way that we walk so that problems can be identified early and accurately. A visual assessment is useful, but it does not provide the evidence that we need to make key decisions on the way that we move. A gait analysis with GaitSmart only takes a few minutes, and that includes the production of the report that we have been reviewing. The GaitSmart system records every movement made and provides you with the exact numbers to represent that movement, as well as a graphical view of the movement. The data is extremely accurate, as GaitSmart has been validated against the optical gait labs that are used in hospitals. An analysis with GaitSmart can take place anywhere on any surface. The portability of GaitSmart means that you can take the lab to the field if you wish. The ease of use and the speed of the GaitSmart process means that GaitSmart is very easy to incorporate into any clinic or sporting environment. GaitSmart is a unique gait measuring device that allows you to better understand the biomechanics of your patient. GaitSmart is the only system that can do this based upon validated accuracy and published evidence.